Heads up.
Good morning. This morning I will address two issues: the use of the AstraZeneca vaccine in Canadian seniors and the federal government's quarantine hotel program. The AstraZeneca COVID-19 vaccine is scheduled to arrive in Canada as early as tomorrow, and plans for its distribution to Canadians are already being made. However, yesterday we learned that Canada's National Advisory Committee on Immunization, or NACI, has recommended against giving the AstraZeneca vaccine to Canadians aged 65 and older, citing a lack of evidence that the vaccine is effective among this age group. For reference, NACI is Canada's top advisory board of experts on the COVID-19 vaccine rollout. Other major European countries have taken a similar position and have decided not to give this vaccine to their seniors. Late yesterday evening, we learned that in spite of this recommendation, Health Canada, the department that is formally in charge of the final decision on who to give vaccines to, has decided to ignore the advice of the experts on the Immunization Task Force and recommend that the AstraZeneca vaccine be given to seniors anyway. With Canadian seniors being particularly vulnerable to COVID-19, the Liberal government must be clear as to why they are recommending to give the AstraZeneca vaccine to Canadian seniors when the Immunization Task Force has recommended against it. More importantly, they must explain the potential impacts of this decision for Canadian seniors. This must happen now, because the AstraZeneca vaccine may arrive as early as tomorrow. The conflicting advice between Health Canada and experts on the Immunization Task Force is concerning. Questions about why this has happened and the potential impacts of following one path over another need to be answered today. Because of this conflicting advice, provinces now have to make decisions about who to deliver this vaccine to and under what circumstances. Canadian seniors will have questions about if this vaccine is effective and why Canada is choosing to give it to them when some government experts have advised against it. It is in the best interest of Canadian seniors to have the discrepancies between the advice that the Immunization Task Force has offered and the Health Canada decision clarified before this happens. Bluntly put, I am concerned that this conflicting advice may lead to vaccine hesitancy among Canadian seniors. I'm concerned that these reports will lead to seniors delaying getting a COVID vaccine if a vaccine they perceive to be more effective than the one offered to them is not available. Given the potential impact of COVID-19 on seniors, the Liberal government cannot let this happen. The best antidote to skepticism is complete transparency on decision-making, and Justin Trudeau needs to provide that today. This is why Conservative members of the Health Committee have called for an emergency meeting to consider a motion that would have expert witnesses testify on this issue so that we can understand which advice is in the best interest of Canadians. We want this meeting to happen as soon as possible and hope that this motion will be unanimously adopted by members from all parties on the committee without delay. Secondly, the federal quarantine hotel program is proving ineffective. Over the last week, horrifying reports of sexual assault, unsafe and deplorable conditions at federal quarantine hotel facilities have emerged. Conservatives were the first to call for the Liberals to enact border measures to secure our country from the threat of COVID-19. At that time, over a year ago, the Liberal government instead said that border measures would make things worse or not work at all. If they would have acted more quickly at the beginning, Canada would have been better positioned to fight the pandemic. A year later, the Liberals instituted a federal hotel quarantine requirement for those entering Canada. We have heard reports that it is taking hours to get through to book these hotels, dietary restrictions are not being met, and food and water is not always readily available. That's in addition to this program continuing after reports of sexual assault. This is mind-boggling. There are other reasons this program is a failure. Government officials were unable to answer the Health Committee what data shows that this hotel requirement was better for public health outcomes than safely quarantining at home. We are also concerned that the haphazard patchwork of exemptions and the lack of consideration for essential and compassionate travelers has left some people stranded. Now is not the time for leisure travel, but we do know that there are still people who will travel for essential purposes. With the number of reasons, time for the Liberals to permanently end this program. Instead of this bungled, mismanaged program, we urge the government to scrap it and replace it with a more effective system of enhanced pre- and post-arrival testing for international travelers and better and safer enforcement of the at-home quarantine. We can protect Canadians from COVID-19 without subjecting them to this type of deplorable and un-Canadian treatment. This is not who we are as Canadians. We can protect Canada from an influx of new cases by using the tools already at our disposal, pre- and post-arrival testing and at-home quarantine. This mandatory hotel program has been bungled and needs to be ended now. Thank you. I'm prepared to answer your questions.
And we'll now take questions, starting with questions on the phone. As a reminder, one question, one follow-up per reporter as usual. Nous allons maintenant passer aux questions. Commençons par les questions au téléphone. Un petit rappel, une question suivie comme à l'habitude par journaliste. Operator, do we have a first question?
Thank you. Merci. To ask questions, please press *1 on your device's keypad. Pour poser des questions, faites *1 sur votre appareil. Première question, Catherine Lévesque, La Presse canadienne. À vous.
Yes, hello. On hotel quarantines, I was just wondering, is it the responsible thing to do to end the program when we have more and more variants in the country?
We did ask for the federal government to provide information showing that the hotel quarantine program was more effective than a combination of pre- and post-arrival testing combined with safe at-home quarantine, and the government has not been able to do this. We know that this is not the time for leisure travel, but there are still people who are essentially traveling for essential purposes. Also, given the deplorable conditions that Canadians have been subjected to in these hotels, the reports of sexual assault, there is a better way. And certainly that the government reacted to our calls to suspend the program with, I think, disdain. There are better ways and better tools that both respect the rights of Canadians while keeping Canadians safe from COVID-19. And I will point out that it was Conservatives who first called for border measures to be enacted, and it was the federal Liberal health minister who said that border measures didn't work and might even make the situation worse. So there are tools available to the federal government that can protect Canadians from the spread of COVID-19 while ending these deplorable and unsafe conditions, and we call upon the government to do that today.
Thank you for that. Yes. CP reported this morning that travel has, in fact, been declining. So is that not proof that the measures that are in place right now are working?
Well, I thought that this was supposed to prevent the spread of COVID-19 among Canadians. And we know that there are many people who enter into Canada every day who are exempt from quarantine measures writ large because we share a large border with the US and we're dependent on that country for trade. This is why we would like the government to examine measures that would protect all Canadians from people entering in and out of the country, like pre- and post-arrival testing, like enhanced at-home quarantine. These are measures that the government should be taking. I don't think that Canadians should have to choose between being protected against COVID-19 and being forced into conditions that are inherently un-Canadian. I think that I've had calls into my office about parents concerned about their daughters going into these hotels. These are our mothers, our brothers, our sisters, people who have had to travel abroad due to deaths in the family or end-of-life care. To hear the conditions that they are being subjected to is absolutely wrong. And I think that, again, to reemphasize, now is not the time for leisure travel. People should not be traveling for leisure purposes. But people who are being subjected to these circumstances now, they also need to be defended, and the government is not doing that.
Next question.
Thank you. Merci. Next question, Andrew Lawton, True North, line open.
Good morning, Michelle. A couple of days ago, Liberal MP Ryan Turnbull had accused you of stoking fear and generating vaccine hesitancy by talking about the very idea of the AstraZeneca vaccine you just mentioned. Before, of course, the council reached the same conclusion that you have been talking about. How do you respond to that charge, which he seems to be doubling down on by continuing to tweet about how safe and effective this vaccine is?
Well, the Conservative Party of Canada will continue to press the government to undertake fact-based, science-based approaches to approving medical products for Canadians. I think it's unfortunate that, liberal backbenchers are engaging in this type of behavior when so much is at stake for Canadians, but I suppose he'll have to answer to his constituents for that.
On the hotel quarantine program, is your position that the execution has been the problem, or do you think that this was just fundamentally a bad idea from the start with no real health benefit to the idea of it?
Well, I've been trying to ascertain that at our health committee by asking questions like, show us the data, show us how this is a more effective system. But we know people are just walking right out of the airport. We know that there are problems with getting people to these facilities. We know that there's problems with getting food at these facilities. We know that people are having a problem getting into these facilities. And reports of sexual assault. It's just the federal Liberal health minister, when I asked her a question about this week, this exact question last week, she said, women have a right to be free of sexual violence, but there's no but in that scenario. And the federal government has a duty of care to people in these facilities. They have not been able to show that they are able to execute that. And we also know that we have tools like pre and post-arrival testing and at-home quarantine that can be used to protect Canadians from the spread of the variant. So certainly I think that we should be looking at undertaking those measures. And I just think it's shameful that the federal government is continuing to subject Canadian citizens to this type of treatment under their care.
Operator, next question.
Thank you. Merci. Prochaine question. Philippe Vincent Fauzy, Radio-Canada. À vous.
Bonjour. Hi, Madame Rempel. I have a question on the AstraZeneca vaccine. France yesterday said okay for the 65 years old and older for the vaccine. And Health Canada said that even though there's not enough information on clinical trials, there's enough information on real life where the vaccine was deployed. I get the confusion, but do you think that, how should these vaccines be used in the public for the next weeks?
Well, that's not a question that the media should be answering or that politicians should be answering. That's a question that experts should be answering. And the situation that we have right now in Canada is that we have a group of highly qualified experts who have been retained by the federal government to inform decisions on the use of vaccines in Canada, saying that the AstraZeneca vaccine should not be used in seniors over the age of 65, citing efficacy concerns. The fact that our regulator, the federal government, Health Canada, has said that it should, has provided a discrepancy that these two bodies need to rectify and answer to both the media, to Canadians, and to legislators in order to make that determination. The lack of clarity right now is problematic, and this is why Conservatives have called for an emergency meeting of the Health Committee to get these experts in front of committee and provide better information for Canadians.
But at the same time, if Health Canada chose not to recommend it for the 65 years and older, isn't it the in a certain way the final call, or like they've looked at everything and they're saying, look, we looked at everything and we still believe that we should inject it to the 65 and older? Like, well, are you concerned about the credibility of Health Canada? I'm just trying to understand what's the issue here. Is it that there's a lack of credibility in Health Canada, or there's a lack of credibility in the health or the committee for the vaccination? I'm trying to understand the point here.
The federal government convened a panel of experts, highly qualified scientists, on something called the Immunization Task Force. And they gave that task force a mandate to look at decisions like this, to provide advice to the federal government on use, on guidelines, on who to distribute vaccines to and under what circumstances. That panel that the government put together has said do not use the AstraZeneca vaccine in persons over age 65 because of efficacy concerns. Health Canada has said otherwise. We need to get to the bottom of why this discrepancy has occurred and what is the choice that's in the better public health interest. The federal government has chosen one path. The advisory committee has said we should take a different path. Given the level of vulnerability that Canadian citizens, seniors have to COVID-19, it is incumbent upon the federal government to provide clarity on this discrepancy, especially given that the AstraZeneca vaccine is scheduled to roll out as early as tomorrow. This is why, again, my job is to get to the bottom of this. It's to get information. This is why we're calling these experts to our committee. Hopefully the motion will pass unanimously at the Health Committee to understand why this discrepancy has occurred and to answer that very question that you asked.
And we'll now take a question from the room.
Hi, thank you for taking our questions. My name is Man Hamidi. I'm with the Canadian Press. The provinces and territories make decisions, actual decisions, on vaccine distribution for certain age groups. Why are you saying that Health Canada is distributing the vaccine?
Well, again, the Immunization Task Force and Health Canada certainly have a major role in approving products that are distributed to the provinces, but certainly also the Immunization Task Force at the federal level is providing recommendations on how vaccines are being distributed, correct? So I think it's very concerning that there's a discrepancy between those two bodies. I want to know why that's occurring, and I think a lot of other Canadians do as well. I would note that I believe the Alberta government has made an announcement yesterday that they will not be using the AstraZeneca vaccine in persons over age 65. But I think that what Canadians want at this juncture of the pandemic is clarity and a clear path forward, particularly when it comes to medical products such as vaccines.
Okay, so, I mean, kind of repeating the question that my colleague asked before. Now, Health Canada is saying this vaccine is safe and effective. NACI is saying this vaccine and the mRNA vaccine has more information on people age 65 and more, and so provinces, they should maybe or could prioritize it for older people. So where is exactly the contradiction here? I mean,
well, again, answering that question is not for me or for you to determine, right? It is up to the regulators. And here we have the panel of experts that the federal government has put together giving one piece of advice that was widely reported last night, and the regulator giving a conflicting piece of advice. I think that the regulator needs to explain clearly why they felt it was in the public's interest to ignore that advice. And I think that Canadians have a right to understand how that decision was made. We want Canadians to get vaccines and to have them available to them should they choose to do so. But this is the type of information that needs to be laid bare to Canadians so that they accept that and push forward with getting one.
Taking third question, kind of, you said conflicting advices. I mean, exactly where is the confliction you're talking about?
Well, the Immunization Task Force has recommended that the persons ages 65 and older should not receive this vaccine, citing a lack of efficacy data, but Health Canada has said it should be used in that age group. So clearly there's a conflict. Thank you.
We'll now go back to questions on the phone. Operator, do we have a next question?
Thank you. Merci. Once again, please press *1 on your device's keypad if you have a question. De nouveau, faites étoile 1 sur votre appareil si vous avez des questions. There are no further questions. Il n'y a plus de questions sur ce moment-ci.
Thank
This
you.
concludes the press conference. Thank you.